Dr. Sheldon Friedman from Friedman Urology. Thanks for coming into the show.
Thanks for having us today.
So you are a urologist,
Yes, I am.
aka Dick Doc.
Okay. We can go with that.
Practitioner of the penis, would that be more professional?
Yeah, that would be more professional.
All right, so you help people that have issues that are related to their genital regions, their nether regions, so to speak. Tell me about some of the things that you commonly help people with at your practice.
Well, urology deals with the urinary tract in men and women, and the sexual function in men. So some of the more common things that we deal with in urology are kidney stones, urinary tract infections, erectile dysfunction, benign enlargement of the prostate that causes obstructive symptoms, just to name a few. We also deal with urinary incontinence in men and women, both stress incontinence and urge incontinence.
Okay, all right. So that covers a lot of issues for a lot of people. Let's talk about a couple of the common procedures that people come and see you for. One of the only times that I've been into a urologist's office is when my ex-husband needed a vasectomy. And we chose vasectomy. And let me tell you what I found interesting about vasectomies, because he really didn't want to do it. He was pretty scared about anything to do with his balls and pain. So, but we found that the procedure was not a painful procedure. How many vasectomies would you say that you have done in your lifetime career? Can you count that high?
Oh, I couldn't even begin to tell you, but I can tell you that we do between 1 and 5 every day, 5 days a week.
So now some of the statistics I found out about vasectomies when researching it is that it is less expensive, more effective, and safer than the female's version, which I guess would be a tubal ligation.
I would say that they're both equally efficacious. I think they both have a very high success rate. Technically, doing a vasectomy on a man is easier than doing a tubal ligation on a woman, because the vasectomy can be done in many cases under a local anesthetic as an office procedure, as opposed to requiring a general anesthetic in a woman.
Okay, yeah. So if someone wanted to have a vasectomy, how difficult is the process? What's involved?
Well, I always want to meet with the patients before I commit to doing the procedure. I want to get a feel for where they are in life in terms of do they have children already? Are they married? Are they going to be a good candidate? I don't want to encourage somebody to do a vasectomy that may be making a rash decision that wasn't well thought of. I want to make sure that both the patients and myself are comfortable with the idea.
Okay, because it's considered permanent birth control.
Yeah, it's permanent birth control, and it's highly effective.
Okay, so if the couple is sure that they are done having children and they're positive they want to do that, then is it just as easy as calling your office up and say, okay, doctor, it was good meeting with you. I'm ready to do this. I'd like to come in Thursday.
I have them come into the office on the Thursday. I explain the procedure. I explain the post-operative care. I want them to have a very good concept as to what to expect. I'll also do a brief exam to make sure I think they're a good candidate for the procedure. But once that's established, I can either do it very quickly, or sometimes patients want to take some time and think it over.
Think about it. Okay.
And I never would rush anybody.
Okay. Well, speaking of quick, I know you've made it very simple at Friedman Urology to take care of the vasectomy without any of the insurance hassles. You have an option to do a cash vasectomy where they come in and it's a flat rate and easy peasy lemon squeezy.
Yeah,
Do you squeeze those lemons when you're doing a vasectomy, Dr. Friedman?
I stay away from the lemons. I'm working above them, and but I do make it easy for people that want to do it quickly and not go through the insurance process.
Okay, so if you'd like more information on Dr. Friedman's Cash and Dash vasectomy special, just call the office at 702-732-0282. Did I get that right?
Yes, that would be right.
I like it. He's a man of the people. He knows his own phone number. That's excellent. All right, thank you, Dr. Friedman, for coming in and telling us a little bit more about what you do at Friedman Urology and more about a vasectomy.
Thank you for having me.
Thanks.